Now we will move towards the type 3 hypersensitivity reaction. The characteristic is immune complex formation. Type 3 is immune complex formation. The core concept here is the antigen antibody complexes are formed. They get deposited into the tissues. That leads to the complement activation, and that leads to the inflammation. Okay. So here antigen may be exogenous, may be endogenous. Exogenous antigen is a bacteria, viruses, while endogenous is seen in SLE, where the DNA material. So there are anti-nuclear antibody they are formed. Okay, so the DNA itself is acting as an antigen. So this is the endogenous. Okay, so normal clearance. What happens normally? These immune complexes, once they are formed, they are phagocytosed or they bind with the RBC. Here, RBC acts as a vehicle. They will carry these immune complexes and they will be cleared in the liver or in the spleen. This is what is the normal mechanism. Once the immune complexes is not something abnormal, but they are formed in a very specific limit which the body can work it on. So these immune complexes will be phagocytosed or they will be binding with RBC. RBC will be acting as a vehicle. RBC will carry them to the liver. Here, liver and the spleen, they will destroy only the immune complex. They will not destroy the RBC. Okay. So normally cleared by the spleen, liver via phagocytosis, via the RBC shuttle. The disease occurs when the load increases than the clearance capacity. So normally the body has got a clearance capacity for immune complexes, but in type 3 type of hypersensitivity, their load is increased. Okay, so what are the pathological triggers? So excess antigen, either there is excess antigen trigger, such as which is seen in chronic infection or autoimmune disease or repeated exposure. Okay, so there may be antibody excess. These antibodies are large and insoluble, and what effect you get? A localized effect. When there is an antigen which is in excess, that will lead to the small soluble antibodies and it will provide the systemic effect. Okay, so there may be antibody excess, there may be antigen excess, and depending upon the type, the effect will be either localized or it will be systemic effect. So a small soluble complex will lead to the systemic disease, while large insoluble complex, when the antibodies are in excess, will lead to the localized effect. Okay, so mechanism of tissue injury in this type of hypersensitivity is a complement activation. We know, we have just seen previously, complement C3A, C5A, they are responsible for chemotaxis and inflammation. Okay, then the phagocytosis, there will be frustrated neutrophils. The phagocytosis mechanism is exhausted. Okay, neutrophil fail to engulf the complexes. So what they will do, they will release the enzyme that will cause the tissue damage. So neutrophil get frustrated, they spill the enzyme and damage the host tissue. Okay, then what are the additional mechanism? The platelet aggregation will lead to the ischemia. Then there is a Hegman factor that will lead to produce kinin and edema. Okay. Then what are the types of type 3 reaction? The reaction for hypersensitivity type 3 may be localized, such as immune complexes are mediated vasculitis. So it is a localized Arthus reaction. This is one of the type 3 reaction. Arthus reaction is one of the type 3 reaction where the local immune complex mediated vasculitis is there. Okay, what happens here? There may be skin insect bite, or second example is a desensitization therapy. You give the antigen. Okay, you give the antigen to sensitize the person, desensitize the person. Okay, another example is a farmer's lung, like actinomycetes or the bird fanciers disease, where there is a local immune complex mediated vasculitis. Okay, so it may be skin or it may be lung. In the skin, you have insect bites, desensitization therapy, or lung, farmer's lung, bird fanciers disease. Okay, so site may be skin, it may be lung. In the skin, there can be insect bite, and antigen is a salivary protein that causes local swelling and redness. Then it may be desensitization therapy, there where we are injecting the antigen that causes local vasculitis. Then another example is in the lung, you have farmer's lung where antigen is actinomycetes that leads to the hypersensitivity pneumonitis. Another example is a bird fanciers disease, that is avian proteins is an antigen, and that leads to the chronic lung infection. Okay. So from examination point of view, remember repeated antigen injection will lead to the Arthus reaction. Arthus reaction is because of the repeated antigen injection. Then there may be effect which is systemic. Okay, up till now we have seen was a local. So another response will be systemic type 3 response. Here the pathogenesis is the small complexes are formed in the blood. They will get deposited into the tissue and there will be inflammation. Okay, which are the sites which are affected? Blood vessels, kidney, joints, that will lead to the vasculitis, glomerulonephritis, arthritis. Okay, so this is important for you to remember. So blood vessels, kidney, joints, they are affected, leading to vasculitis, glomerulitis, arthritis. So if you are given the example and asked to classify the disease, if it is related to this, select the type 3 hypersensitivity. Okay. So important diseases like SLE, where anti-DNA antibodies are there, rheumatoid arthritis, polyarthritis nodosa. So autoimmune disorder, if you get, it is the type 3 type of hypersensitivity reaction. Okay, then infections like bacterial, there will be post-streptococcal glomerulonephritis, virus infection like hepatitis B, hepatitis C, parasitic like malaria nephropathy, others like dengue, Epstein-Barr virus, etc. Other like a serum sickness, subacute bacterial endocarditis, then hyperacute graft rejection. These are type 3 type of hypersensitivity reaction. What happens in the serum sickness? This is frequently a serum sickness. Okay, there is a foreign serum like horse serum, etc. With a gap of around 7 to 8 days of exposure, you see this serum sickness. There is a clinically fever, vasculitis, edema, erythema. There may be glomerulonephritis also. And what is the outcome? It resolves after immune complex. Once the immune complexes are cleared, it will resolve. Okay, so that is the type 3 type of hypersensitivity reaction.